Hey mamas, and welcome to the Entering Motherhood podcast. I'm your host, Sarah Marie Bilger, a wife, mom of two, VBAC mama, and doula. Join us every episode to learn from professionals, special guests, and moms just like you, ensuring that you know what you need to know and discover things that you didn't know before. I believe in you. Let's doula this, and let's navigate the transition of entering motherhood together. Hey mamas, I'm so excited to bring you this episode because this is actually a clip from our full interview with Dr. Stu for our Own Your Birth childbirth education course. And so this is really just kind of like the first few minutes of our conversation. And we specifically are talking about finding a care provider, what that kind of looks like, and getting his insight on what the process can be like and his advice and insights from his experience as an OB and what he has done and how he advocates for women in the birth space. And it is just such an insightful conversation. And we enjoyed talking with him. But like I said, this is just a small portion from our full interview with Dr. Stu. So if you enjoy this episode, I encourage you to look into our childbirth education course and hear from him and other individuals like him on different conversations and different topics that can help support you during your preparation for birth and beyond. And obviously, the majority of the course is taught by Katelyn and I. We go over so many topics, but I am so excited to share this specific portion with you today. Check the links in the description to learn more about our course, but this episode is just great all by itself. So here we go. All right. Well, hello and welcome. We're super excited to have you here as a bonus portion of our course and get this conversation started. So I'm going to let Katelyn kind of lead and move forward.
Well, thanks for having me.
Yeah, we're so excited to have Dr. Stu on. He's such a pioneer in breech and reteaching breech birth and advocating and all of that. And we're just so excited that he is willing to come share some of his knowledge with us. So we'll just get started. So Dr. Stu, as an OB and somebody who has worked in the hospital system and worked outside of the hospital system and seen really all different sorts of birth, how can moms know to trust their instincts while navigating this process of finding a provider and somebody who truly aligns with what they want and truly supports them as a whole person and not just an accident waiting to happen? What are some red flags you can look out for, some green lights, so to say, and just to know that they have that right fit of a provider for them?
Okay, well, this is a really broad question, so I'll probably monologue a little bit and we'll see where it goes. First of all, before you ever get pregnant, you should probably try, as a woman, maybe you do, some women do, some women don't, but you should really think ahead of what it is that you like. And when you're seeking out a partner, these are the things that you want to discuss maybe before you commit to something and decide what's important to you. A lot of it has to do with our legacies and our heritage. Medicine has become, at least medical training has become a bit of a cult. And it's very hard to break away from a cult. And even when you do break away, if you just know anything about cults, you continue to have cognitive dissonance and little things in your gut that tell you shouldn't do this or you should do that. Each individual person needs to look at their own individual values and history. There is no right way to do something. I mean, the medical model, which sort of we pick on, or I pick on a lot because I think they do a lot of stuff wrong, occasionally gets it right. It's more than just a broken clock being right twice a day. They do some things right. The problem is they don't know when to stop, and everything that they do has mission creep. And then there's conflicts of interest like expediency and monetary reward and medical legal concerns. And these pressures are put on what are generally considered good people. Bad people generally don't want to go to medical school. It is a long journey, and it's very delayed reward. And now the reward isn't even where it was 20, 30 years ago, because most people who went to medical school in those days were individualists. They sort of wanted to captain of their own ship. They wanted to be in charge. And so you had that type of personality. Nowadays, most doctors are just employees. They just work for somebody and they work a shift. And so they're not necessarily responsible for the lives that they take care of when they're not on. And that doesn't suit certain personalities. So you have to, when you're looking for a practitioner, you have to realize where they're coming from as well. And we come in all colors and sizes as doctors, but the motivation is different. And that's why I like the midwifery model a lot, because the midwives haven't yet been captured for the most part. Hospital-based midwives have, and corporate midwives have, but private midwives have not. So their fiduciary duty and their responsibility is still to the individual woman. And some women who are looking will desire that. They desire to design their own birth. And other people want to abdicate that responsibility. And they may not do well in that model. They may do well in a model where they're told what to do and they don't want to think about it. I think that's not a good choice to make personally, because how you give birth will be, and the memory of your birth will be with you your entire life. And from our perspective, I hear stories all the time of women who had bad experiences. I tend to be a lightning rod for those sorts of things, or didn't know something the first time around and then only found out after they were traumatized in some way, and they did it better the second time. So question of how to advocate for yourself becomes on what it is that you want. And if you don't know what you want, then you really can't figure that out. So you got to figure it out ahead of time. You got to be in sync with your partner. I do believe that is really important, because it can make a bond really strong, or it can work against a bond. If you want a home birth and your partner is very scared about that, that's something that should be talked about before you're 7 months pregnant. You need to, these sorts of things. And then, you need to decide, where do you feel safe? There's no such thing as a definition of safety. And maybe later we'll talk about there's no such thing as a definition of high risk either, but maybe we'll get to that. But there's no such thing as a definition of safety. And so one person may feel safe in the hospital, another person may feel scared out of their mind in the hospital and feel safer in their own bedroom or their own kitchen, or their own backyard, or their own birth center that's nearby, or whatever, but just staying out of the hospital. So it's not in anyone's best interest or it's not even ethical to tell women what they should be doing. This is a problem with the medical model, because the medical model works algorithmically. Everybody's on the same model, especially when it's a corporate-run business. For instance, I use this example all the time, but Kaiser Permanente in Southern California has some of their institutions that say you cannot go past 41 weeks. So the doctors will end up having to skew their counseling to get somebody to do something that they know ethically is probably incorrect, because there's no reason you can't go past 41 weeks unless there's a reason. Because you're pregnant in 41 weeks is not a reason that you can't be beyond that. And yet you'll be in an environment where that's not given to you as an option. So you need to know that going in ahead of time. What are some of the things what are some of the restrictions that we have, and what are some of the rules that may apply? And just because it's a rule, does that mean I have to follow it? And this gets me to the old Pirates of the Caribbean thing where they talk about the code, and somebody says, well, it's not really a code, it's more like guidelines, actually. And people don't know that because they inform you in a way that makes it sound authoritative and that you have to do what we're telling you. There's
And
this.
I think that's a big thing that often gets so overlooked and that is not shared enough. But when a medical professional is recommending something, they can definitely make it sound like, if you don't do this, this is the end of the world. But you always have that choice. You can always say no.
Yeah, and in certain situations where, again, most of us inside, we've lost our trust in it, but inside we have a common sense-o-meter, for lack of a better term. And if somebody's telling you something that doesn't seem to make sense to you, it's probably something that should put up a red flag and say, wait a minute, I need more time, I need more explanation on that, because that just doesn't make sense. I'll give you an example, because I just was reading an email before I came on, and it used to be that before you got an epidural, the anesthesiologist would want to give you a liter or two of fluid. You guys know this?
Mm-hmm.
They'd want to hydrate you because the epidural can sometimes lower your blood pressure. Well, this woman wrote to me and said at her hospital and a bunch of hospitals, there's an IV bag shortage. So suddenly now they're giving epidurals without hydrating you. So the question was, one, are you doing that because of monetary gain? Or two, was it unnecessary all these years and you were giving me extra fluid for monetary gain? I mean, which one was it? If it's so important to have 2 bags of fluid before you put an
Right.
epidural, how come you're not now putting 2 bags of fluid in because there's a bag shortage?
Yeah. Well,
Right.
then that leads to so many other things down the road, like artificial inflated weight of the baby and all of this stuff. And then it looks like they've dropped all this weight and now they're pushing formula and, it's just like a domino effect.
Right, and if they, and if they pull out that this is dangerous, because listen, when you're pregnant, there's nothing more important in your life than the life of your baby. And everybody wants a perfect baby
Mhm.
because the minute that stick turns to color, you're already planning your next 18 years of envisioning your kid riding a tricycle and playing soccer and, you know, dressing them up certain ways if it's a girl or whatever, and
Yeah.
getting their first baseball bat if it's a boy, or, I know I'm dating myself, but that's how we did things. And so when something is that important to you, it's very easy to be manipulated,
Mhm.
because if somebody says, don't eat that donut because you might get a heart attack, it's not the same as saying, don't go beyond this date because your baby might die.
Yeah.
Okay. They're two different things, but I mean, one, you can ignore it, and the other one, you're too scared to ignore it because you really don't care about the donut, or tomorrow you'll just take a day off and you won't eat
Yeah.
as much and you'll make up for it. But in pregnancy, we have this thing where this is the most valuable thing. You'll remember every bit of it, and you'll remember it till the day you die. So you have to understand that when you carry that sort of burden, if it's a burden, it's easy to be manipulated. And fear is the greatest manipulator.
Yeah.
And because most of my colleagues, including myself, when I came out of training, were trained in a fear-based model, a cult, so to speak, that not only are we scared about pregnancy, but then because we're scared, we project our fear onto the women that we're caring for. And it's very obvious to see that.
Yeah. And I think, like, generation to generation, it's so hard to kind of get out of that. I mean, your parents are also, like, both of Katelyn and I had cesareans for our first, and then we went on to have completely unmedicated VBACs. But, like, my family was terrified. They're like, what do you mean you're going to try for a vaginal birth? That's not safe. And, you get kind of like polluted with all of these people also projecting fear. Not only is your provider now, scared and unsure if you can do it, but everybody around you is as well. And so, like, how do we start to really gain that confidence to be able to know that our body is capable of doing these things, or that we are making the correct decisions? And, hopefully people are, trying to educate and learn before they get pregnant. But most of the time, it really is just a short amount of time to be able to, flood yourself with all of this information to kind of make those decisions.
Well, these are very personal decisions, and it depends on your relationship with your family and your family's history. But if your parents are that kind of a parent, you want to go to Moscow for vacation? Why would you do that? That passive aggressive sort of tone in their voice. Then you don't tell them that you're going to Moscow for vacation. Okay.
Yeah.
So it's the same thing here. You tell them the great news, and if they assume you're going to the hospital, that's what you have to do. Ideally, you'd have a relationship where you communicate, and you can do that. But every person has to assess their own social setting and their own history. I mean, if you had a grandma that had 8 babies at home and your mother had 5 babies at home, you got no problem, right? But if your grandma had 3 C-sections and your mother had 2 C-sections, then the history is going to be our family doesn't have vaginal births.
Mm-hmm.
Because my doctor 30 years ago said that it was dangerous to do that. It was dangerous to have that breech baby.
Mm-hmm.
So, and they get a loyalty to that. And again, it gets back, you can't get away from cognitive dissonance. Cognitive dissonance is having 2 thoughts that are in opposition to each other. And in order to deal with that, we have to find a way to mitigate that, because nobody likes to live in that sort of world. One of the key things we do is to cherry pick data and ignore other data. And another thing we do is to either block out or ridicule anybody who's telling us information that's different from what we feel, because that information makes us feel bad. Another example would be you buy a large screen TV for your house and you put it up on the wall and you have some friends over to watch a football game. And one of your friends says to you, "Oh, that's a nice TV. Where'd you get it?" And I say, "Oh, I got it at Costco." "Oh, how much did you spend?" "I could have got it for you for, cheaper at Walmart." It's like, did I need to know that? Did I really need to know that? That's the kind of person you would not want at your birth.
Yeah.
You don't want that person there.
Mm-hmm.
So you have to be discerning and try to figure out, you know, how to navigate that. And again, there is no secret formula. But I will say, getting back to common sense and your gut, what is your gut telling you? If you go to someplace and you don't feel good, one of the classic things, and I think I got this from the Down to Birth podcast people, was how do you feel when you're going to your doctor's office for an OB appointment, or your midwife for that matter? And usually you're a little nervous, a little apprehensive. Technically, every time you go to the doctor, you probably feel that way a little bit, just in that stupid waiting room. The question is, how do you feel when you left? Did you feel worse? Were you more frightened? Or were you feeling reassured? Were you feeling that this person has my back and I feel good about it? And that you can't teach that either. That's just one of those things that's in our sense. If somebody gives you the time of day, if they make eye contact with you, if they're not typing into a computer or having one foot out the door, if you feel rushed or hurried, these are things that you should acknowledge, and you have to decide, how important is that to me? And make a decision of whether or not this is the right office for me or the right caretaker for me. And always, when you get some information that might be a little traumatizing, is to take the count to 10 rule. Don't panic. Don't react on it immediately. Think about it. Do a little digging. Best thing you can possibly do if it's something that's confusing is get a second independent opinion. So if somebody tells you they see something on ultrasound and they want to see you back in 4 weeks for something, even though it doesn't sound like much, it's still going to plant that seed in your brain that my baby's perfect, but one of the kidneys is dilated slightly, and that could be a real problem. And I need to see you back to make sure it's gone. And like, no, you don't, but you do. That's what you're told. If you do get a follow-up ultrasound, go someplace else and get an opinion from somebody else. And you don't even have to necessarily tell them that the first doctor 3 weeks ago found a dilated right kidney. And after they tell you everything's perfect, just say, "Did the kidneys look fine?" They go, "Yeah, okay, great, thanks." That, you have to take control of this thing. You have to theoretically spend money. Don't just pick your insurance card and say, "This person's been doing my pap smear for 10 years. I'm just going to let them deliver my baby." That's not how it should work.
And I feel like it happens way too often like that.
It's like out of convenience or out of, sort of your funnel down your path because your insurance company says you only have this group of providers to go to. No, they can't. That's, again, that you're being sort of subtly coerced. You're being told information that isn't true. You can go anywhere you want, but it might cost you money. So another thing you can do when you're young is you could start a savings account. It's hard for people to do these days, but, putting $20 a week from the time you're 18 into a account for spending on your birth. And if you end up using your insurance card, then you got money to buy a nice stroller, or you got, money to take a nice baby moon or something like that.
Mhm.
But you've got some money put aside. Don't rely on a third party to have your back, because third parties don't have your back.
Well, and another thing is if you're relying on insurance to cover your birth, then you're gonna more than likely be limited to a hospital birth or somewhere that is dictated by insurance. And I think we can all agree that insurance does not have our best interest at heart. They have money at heart, and that's what they're
Yeah, the
thinking about.
insurance industry's business is to make money. And they make money by taking in your premiums and being very stingy about paying out your claims. That's how they make money. And if they can get a doctor to accept $2,000 for your birth instead of $2,500 for your birth, they're going to do that. This reminds me, back in the 90s, there was a big craze about LASIK surgery. You guys were probably too little to remember. There were billboards all over the place, and you could.
I have terrible
LASIK.
eyesight, so it's always been
kind of
Yeah,
an
you could get
option.
LASIK surgery, and normal LASIK surgery costs $2,000 an eye, and you're seeing billboards that say $399 an eye, $399. It's like, yeah, I want somebody, the lowest bidder, to operate on my eyesight, but some people will,
Uh-huh.
and so you have to again investigate that. I mean,
Yeah.
it's hard because doctors, you can't look them up in Consumer Reports like you can for a car or a lawnmower or something. You have to take word of mouth, and if you have girlfriends who are like-minded, who have a good experience with their doctor, that's a big plus.
And I think that's the biggest thing, like-minded. You can't just take somebody who's like, I'm just going to give an example here. My primary care doctor, I love him. He's a very holistically minded doctor, but his wife had 5 C-sections. And so when he recommended an OB test, I was like, nope.
Yeah.
you know? And I was like,
No, it's very important. And if you're somebody that just wants to get in and get out, that's okay. But if you're somebody who comes in with questions and you don't feel like your questions are being answered, listen to your gut. That's not the practice for you. You are the consumer. They are providers of a service. What we tolerate from our obstetricians in our obstetric system, we would never tolerate from a restaurant. I would like the filet mignon. You can have the barbecue, or you can have the chicken fried steak. No, I want the filet mignon. No, you can't have that.
Yeah.
It's dangerous. It's bad for you.
You
Really
get
bad.
up and leave.
Right.
You would.
Yeah, you would never. You wouldn't go back. You
Yeah.
might not leave, but you wouldn't go back. And it's the same thing with any service person. So what I often tell women who are looking for the first time to find an OB for their pregnancy, and again, ideally doing it before you're pregnant is a great idea, but if you're early pregnancy, that first visit, go in there and you interview them. In other words, you don't let them take your blood pressure, you don't let them draw any blood, you don't let them do anything. You want to sit in the room, and the doctor comes in and says, "Oh, I see you didn't have any vital signs taken." He says, "I'm not here for that today. I'm just here. I'm paying for a visit so that I can talk to you and see how they respond. Because if they respond in a cordial way, that's a great sign. But you're interviewing them,
Yeah.
and then you'll let them know."
Okay, mamas. So thank you so much for listening to this. Again, this was a portion of the interview that we had with Dr. Stu that is part of our Own Your Birth childbirth education course that we would love for you to come and join us on and with. We have multiple other interviews with different professionals and individuals, and then majority of the course is taught by Katelyn and I, and we cover so many other topics. This interview specifically has probably close to another hour of content with Dr. Stu. We bring documents and worksheets that he has and different PowerPoint presentations that he has shared with us to really give you a full picture and insight on different topics related to childbirth and just beyond. We specifically talk about VBAC and cesarean because that is so much a part of Katelyn and I's stories. And we really just get so much more insight from him specifically that we are so excited to share and so honored to have had him be a bonus portion of our course. If you want to find more information about the course, you can always check the links in the description, or you can feel free to reach out to Katelyn and I and ask us more questions about it and see if it would be a good fit for you. We have a Facebook community around the course that is specifically just for individuals taking the course, that we have the opportunity to connect with us and ask more questions and just have a community aspect that goes along with it. But I hope you have enjoyed this episode specifically. And as always, thank you for being here. Thank you, mamas, so much for listening. Remember, you are a rock star. I believe in you. Let's doula this. Let's crank it up a notch and let's kick it into high gear together. Hit that subscribe button, share this episode with a friend, message me, email me, call me, beat me. You know how to reach me. We're doing this, mamas. I am so excited to catch you here next week. This is your one-stop go-to place for helping you find the resources you need to make the best choices for you and your family during pregnancy, birth, and most importantly, postpartum. See you later, mamas.